All right. Well, I just saw the red button go on in the corner there. That means we're live. And I would like to say hello to everyone who is watching right now. Thank you for joining us. And my name is Michael Wadowitz. My pronouns are he, him. In my day job, I am the director of AIDS Project Rhode Island, overseeing a variety of services and programs in that capacity. But tonight I'm really excited to have several people that I have the pleasure of working with in the community and around the state joining us to talk about sexual health, HIV testing, PrEP, and a bunch of other things as we all navigate COVID. And I just, first of all, thank you everyone for joining us. I'm gonna just say a couple of words to start, and then I'm gonna introduce everyone and we'll get going. If you have questions while you're watching, feel free to type them into the chat, and we will take a pause occasionally to talk about whatever you're asking, answer some questions, and I'll be kind of farming out some questions to various folks. So what I wanted to tell everyone, first of all, just a couple of housekeeping notes. We will be on mute when we're not talking, so let us have a second to kind of respond, just so we don't overlap. But I also wanted to remind everyone out there and on the call, I think 6 days left now to do the census. So if you have not filled out the census yet, please do so. It's a very important thing, especially for those of us living in Rhode Island. We're such a small state that we rely pretty heavily on a lot of federal funding, and we are in danger of losing a congressional seat at the moment in the House, and we don't want to see that happen. So it's a confidential thing. It's available in multiple languages. You can do it on the phone, you can do it online or on paper, but go to 2020census.gov to fill that out if you have not, and we appreciate that. And also, if you're not registered to vote, register to vote November 3rd. Do it by mail or do it in person. Make sure you wear your mask. So now to get started, the whole reason for doing this to begin with was kind of really to talk about, and we're in an exceptional moment here in our history. Most of us probably have never been in a moment quite like this, where we have a global pandemic that's kind of like a black cloud over a lot of us every day. But of course, that doesn't mean that we can just kind of stop everything. We have to continue living our lives. We're trying to figure out how to navigate everything from childcare to day jobs to what we're doing on a daily basis. And I think a lot of us here on this call, or this, whatever you want to call it, we'll call it a call. We work with people every day that we know are still sexually active. And that's why we called this tonight, People Are Still Having Sex. We also, all of us know that shaming people, quote unquote, around their sexual health or their sexual activity doesn't change behavior. People still need access to things like sexual health testing, HIV testing, STI testing, PrEP referrals, and more. So what we're here for tonight is really to have everyone involved answer some questions about where we're at, how to access services, and to field any questions from anyone watching about these issues and see how we can be helpful. So I'd like to get started, and I'll do a very quick introduction of our panelists tonight, and then we'll get going with our questions. So I'm just going to go with how I can see everyone on my screen. And starting with Rich Holcomb, who is the founder of Project Weber and now works at Project Weber Renew as a caseworker who works primarily with high-risk men who have sex with men and male sex workers. Hi, Rich.
Hey.
Jean Hernandez, who is a peer health navigator at AIDS Project Rhode Island, who also oversees the Keep It Up program there. That is a program designed to work with young MSM, men who have sex with men, and connect them to testing and PrEP services. Hi, Jean.
Hey, guys.
Sorry, there's always a pause. I have to remember that. Ray Joseph, who heads up the prevention program, as he says, all things prevention at AIDS Care Ocean State, and also oversees the needle exchange program there. Hi, Ray.
Hello, hello.
Doreen Donnelly, who is a nurse practitioner at Thundermist Health Center's Convenient Care, who is joining us tonight as well. Hi, Doreen.
Hello. Happy to be here.
Nice to have you. Michaela Maynard, a nurse practitioner who's at Lifespan's Division of Infectious Diseases and the Rhode Island STD Clinic, and I know does a lot of work around testing and PrEP.
Hi, everyone. Good evening.
Last but certainly not least, Mr. Matt Murphy, who is the medical director at Open Door Health, which is a relatively newly launched health center here in Providence that is focusing a lot on LGBTQ+ health. Hi, Matt.
Hey, everyone. Happy to be here.
So I wanted to start a little bit, and Doreen, I'm going to kind of put you on the spot, I guess, to start, which is to talk a little bit, just to talk a little bit about, like, so here we are at this really exceptional moment in time, like during COVID. And, you know, we know a lot of people are not necessarily in long-term monogamous relationships. And we know that telling people not to be sexually active is not really a working model. So what are you talking to your patients or clients about right now about how to have?
I'm sorry, I missed the last part of your question.
I was just asking, how are you talking to your clients or patients right now about how to safely have sex or be sexually active during COVID?
I have to say, working in convenient care, we do walk-in, and we do a fair amount of people coming in for STI testing, I apologize. I did STI work back about 15 years ago, so I do get sort of STD, STI sometimes. But I do have people coming in when they're getting testing, and I also have people coming in just asking general questions. I always sort of start off that coronavirus is a respiratory illness. It's transmitted through saliva and intimate contact. COVID is not transmittable from sex, not directly genitally transmitted. But the sex causes intimacy and close contact. So sex can contribute to spreading the COVID virus. So in general, that's basically how I begin. I also have never been a fan of telling people not to have sex or sort of in general, just to sort of be safe. I'm very, very much thoughtful about how I talk about risk reduction. So we sort of have a conversation about what they're currently doing and think of ways to reduce their risk of both STIs and COVID. So some of it overlaps. There's actually what I found on advocate.com was 15 tips for safe sex during COVID. And I find it a little bit interesting. A fair amount of it we use for STIs risk reduction, but it was kind of interesting. So I'll just go quickly through them. The first is the safest sex is solo sex. So everyone open up to masturbation. The second is call for help. So that is using phone or video sex instead of in person, with the caution that videos can induce sexual exploitation. So I think you have to be very careful about that. The third was find a sex buddy, someone within the group that you sort of hang in or in your quarantine people living together, your people that you know well. But having sex with someone you know has always been sort of safer than having sex with people you don't know. The fourth one, do you mind me going through all of this? The fourth one was postpone the orgy. So really stay away from groups regarding sexual activity, as well as we have to sort of restrict our in ourselves from large groups in general. Pick a partner you can trust. And again, I've always included that sort of for people to know about the person they're having sex with, first and last name, knowing what kind of sex that person is involved in, knowing their status of STDs, and being tested for STDs is only sort of the moment in time. So if everything is negative, then that doesn't necessarily mean the next person they have sex with did not give them an STD. So limiting partners is really, really thoughtful. Know the symptoms of COVID. So I think everybody hears it. Basically, every medical office you go into, so many places are basically asking the same questions. So I'm going to sort of leave that as it is. The seventh was pick a well-ventilated large area for lovemaking. Open a window or consider having sex outside. The eighth was wear a mask, and it does make sense. Sexual contact does cause very close face-to-face encounters. So having a mask that you use only for sex, having something that sort of can help the mood, it will cover kind of that heavy breathing and panting that sometimes occurs. Wearing a condom, again, that goes pretty much without saying, but using a condom not only for sex, but there was actually some thought around using condoms or gloves on your hands when you're having sex, and then washing before and after. There was a lot of talk on many websites about avoiding rimming because we have found that there is virus in fecal material, although there's been no transmission through sexual contact. Masturbation, trying mutual masturbation with the person you're having sex with. Trying different positions that sort of reduce face-to-face contact. Practice cleanliness, as I just said, sort of taking a shower, using hand sanitizer, washing sheets. And then lastly, get tested. So if you have an encounter with someone you don't know or an encounter with a large group, get tested for COVID. And you can get tested more than once. A test in May that was negative does not mean it's negative today.
Right, that makes sense. I mean, those are pretty practical details. I'm wondering too, like Matt, for example, do you know I mean, we're really only about 6 months into this, but do we have any data yet about HIV or STI rates during the last 6 months since COVID started? Have they dropped or are they up? Do we know?
Yeah, unfortunately, and I continue to review the peer-reviewed literature that's out there. And while there's definitely a lot of concern amongst experts and amongst leaders in the field, there isn't a lot of great data quite yet, which is showing an increase in incidence of STIs during this time. But I definitely think the concern is there's kind of two sort of layers of concern. One is that there are folks who are, there's certainly this change in sexual behaviors that we don't necessarily understand quite yet. So are folks, perhaps participating in more, certain kind of sexual behaviors which are less likely to contribute to the spread of COVID, such as like oral sex, so sort of mouth to genital sex, which you can still transmit certain STIs, but folks' perception of the risk might be lower. So what the changes in behavior are, but then also the folks seeking out testing and are not getting tested as much. So even if the concern is that there may very well be changes in the amount of STIs being transmitted in real time. We don't really know what the impact has been, but regardless, we are likely not seeing whatever that impact is because people aren't getting tested. And so we're sort of operating in a period of time where we don't really know. And of course, as a public health provider and as a physician, making decisions and making recommendations with a lack of evidence is something that we are generally uncomfortable with. So I think COVID has in many ways contributed to being in a space and trying to work with patients and on issues where sometimes we don't have the best evidence, or we don't have access to the best data because of everything that's going on.
Thanks, Matt. Ray, that actually made me think for you. I know you've been at AIDS Care Ocean State. You've resumed in-person testing not so long ago. Have you seen an increased demand for HIV testing for people that you would interact with, or questions from people about their sexual health and COVID?
Yeah, we have seen an increase, but I don't know if it's an increase overall. When the COVID first struck, mid-March, everything shut down, and we didn't resume testing until about mid-June. So for those 3 months, we were kind of at a standstill. Other services were going on, but testing is what we weren't sure how to navigate. But since June, we were able to open up our testing and found a way to provide testing in a safe way, not only for our clients, but for our staff as well. And we have been seeing more people coming in for testing, but I think that's because of that 3-month lull that we weren't open for testing yet. But the one thing that we are seeing too, we are seeing a lot of people not only HIV testing, requesting HIV testing, but also testing for STIs as well, saying that their primary doctor can't see them right away, or the clinics might be backed up a little bit, and so they're wondering if they could come in for STI testing with us, which isn't something that we provide as of yet.
Yeah, I know. I'm sure, Rich, you can probably talk to this a little bit too, because we've talked before about how communities being really impacted by COVID are historically been really impacted by HIV too. Are you seeing a lot of that, a concern among your clients at the moment?
As far as especially with like the ones who are engaging in substance use. Many of our clients, especially the male sex workers and high risk MSM who are engaging in crystal meth use, a lot of times, those guys tend to, in my experiences with them, when they don't know where they're going to sleep that night, they don't know where their next hit of drugs is coming from. They don't know when the next meals is coming from. It's really hard for them to get to care about themselves and their own well-being when their immediate needs are not met and they're addicted to a substance. So getting them to, to care about those issues is really been the challenge with us from the beginning of our, the start of our organization is in spite of these people's circumstances, to sort of get them to care about HIV, to get them to care about COVID, to get them to care about their well-being is certainly challenging. And we've made progress with many of our clients in that regard, but still, I mean, we have clients who don't believe COVID's real. We have clients who believe this is a government conspiracy and none of it's real and they don't need to wear a mask. Some of that is sort of heightened by issues of mental illness. Some of that is heightened by their crystal meth addiction and sort of being paranoid about everything. So we see it all from across the board. And then, of course, we have people, in spite of being homeless, in spite of being addicted to drugs, they still are using condoms and coming into the center and getting tested for HIV, and always ask us for masks and stuff during outreach, because we do we are out there giving out masks to the general public during our mobile outreach and stuff. So, yeah.
Jean, I'm curious too, because I know with some of the work that you're doing, you're interacting with a lot of young men who have sex with men. Like, what are they saying about COVID right now?
So a lot of what Rich was saying, mostly surrounding the idea that the government's creating this bonfire of too much information and panic. So there's like this fear of trusting the government or getting tested, but also the fear of COVID in and of itself. Just from the small survey I did do with the community, I found that they do believe that it's a serious virus. They just don't like how there's this lack of treatment for it, or this bubble of inflation of like their risk and concerns. They do believe that they should be taking the precautions of COVID, but they're also coming from this place where I have too much information. I don't know what to trust. I don't know what I should follow. So I could say that they have like the level of disbelief, but also a level of trusting their own selves and judgment towards like their understanding of viruses.
So I guess, Michaela, I originally had like a kind of like already written question, but now with everything that's happening, I'm wondering if you're kind of seeing the same things that everyone's talking about, and how you're interacting with patients about COVID and their sexual health, just kind of in general, if you can tell me a little bit about that.
Sure. I think we've been fortunate at the STI clinic to be able to see patients throughout the entire pandemic. We've certainly had changes in the way that we're seeing patients. We used to see them walk in, and now we're seeing them by appointment only. And there was a period of time where we had very limited hours, but in general, we've been very accessible to patients. And I think I think that patients are finding that there's little access to services. I think that we're finding that, as you all mentioned, patients want to be screened. They want to be screened for HIV, for STIs. They want to talk about PrEP. They want to talk about sex. And unfortunately, there are lots of places that are not allowing patients to come in because of the different regulations and policies. So I think there's a need for patients to feel comfortable and to feel like they can that these places are accessible. And I think people are afraid. I think they're afraid to admit that they're having sex. I mean, goodness, there's so much stigma about safe sex and sex in general, and now throw COVID on top of it, and we have an even bigger scenario. So I think we all have to sort of remember that this is happening, and we have to kind of do whatever we can to help our patients.
Thanks.
I'd like to just jump in for a minute. So talking about access, so I work for Thundermist. We have 3 health centers, Woonsocket, West Warwick, and South County. We have not closed our doors for a moment. We were doing STI testing all the way through. Again, we're seeing people for lots of illnesses. What we're not seeing directly in convenient care inside our clinic are people with respiratory symptoms. So anyone who has respiratory symptoms is then deferred to Thundermist respiratory clinics, which are very, very busy. And they're providing all services, but they're providing services to people that may have a cough and doing a COVID test. And by the way, I need STI testing. So we are providing absolutely all service. We're doing annual physicals. We're doing remote visits by telephone, and we're doing in-person visits at all of our sites.
Yeah, I know there's a little bit of a difference there too between like community-based organizations and then like actual medical facilities that have the ability to do some, a little bit more advanced care. But like Ray, for example, I'm curious with your experience so far, because I know ACOS is really in charge too of the needle exchange program. What's that experience been like? Are clients wanting those services or referrals for other things as well to go to medical clinics?
Yeah, so for the needle exchange program, that's something that we never stopped doing, even throughout the height of COVID. The name of the game for the needle exchange program is trying to be innovative with our services, and we took that before COVID, during COVID, and after COVID. So during COVID, at the beginning March, April, we set up a food truck style syringe exchange program. So clients would be able to come up to the van. We had the van parked outside the office. We weren't letting clients inside the office, but still able to get all the services they need and all the referrals that they needed. A lot of them were skeptical of going to different places, either it be methadone treatments or detoxes or anything like that. But we made sure that we had the places that we knew were open and that we knew that we're accepting people right on hand. So that way we can give it to clients without missing a step with them. And Project Weber Renew has done the same thing too, as far as the exchange and the street outreach. Never stopped operating those services. I think the tricky part was the testing is a little bit more of an intimate setting as far as doing either an oral swab or the finger stick, but with the rapid testing. So that we had to try to maneuver and figure out. But as far as the exchange goes, that's something that we figured out right away, and we knew it was a vital service to the community, and we didn't want to stop it at all.
And I mean, to that point, Rich, like Ray was just saying with Project Weber Renew, I know you've pretty much been keeping going the whole time too. What are some of the strategies you've been using to make sure that people have access to all the services they need?
Well, like Ray was saying, we've had to be very creative. One thing that we do is we do a lot of peer support. So where some of that sort of the peer support staff, the peer support meetings would have happened in our drop-in center. Because the drop-in center is closed, some of those have been moved virtually. We've had to meet one-on-one with clients virtually to sort of check in, see what they need, depending on their stages of change. Some of the people that we provide service to, they're in the middle of their active drug addiction, they're homeless. Other people are in recovery houses and abstinent from drugs. So we want to make sure that we're connecting with those people, that we're addressing their needs in the best way we can. So, for instance, the trans support group just had a small cookout last week, I believe, and they'll be Ashley, our prevention case manager, she's having a cookout for the females next week. So we're doing what we can to sort of, bring people together with following the state guidelines of meetings and wearing masks and being socially distant. But even just driving in our outreach van to a recovery house where, one of our clients might have 30 days clean and no job, and he's just sort of sitting in the recovery house and he can't go out to 12-step meetings. That's another thing too that we're seeing, a big problem right now is people who are entering the 12-step recovery and realizing that they can't attend meetings. So everything's virtually now for that stuff. So we try to give them that sort of support when we can, because we know how difficult it is, especially with someone early recovery, when they're not able to connect with other people in recovery. It could be pretty devastating and difficult. So we do what we can, for these people.
Go ahead. Sorry.
I was just going to say, we're not open for testing Monday through Friday right now. We're actually, Project Weber Renew is doing testing in a tent once a week for right now. So on Tuesdays at 12 o'clock, people are able to go there and get a rapid test for HIV or hepatitis C. But that's going to be changing in the days ahead. We'll be open more for that. So.
And I think, Ray, I'll ask you in a second too, but I just wanted to mention really quickly, like I get to work with Gene on a daily basis. So that's a nice little synergy here. But so I know we're not currently, AIDS Project Rhode Island hasn't been doing in-person testing recently, but Gene, do you want to talk a little bit about some of the strategies you've been using for testing?
Yeah, so we also saw the huge gap of services once COVID hit. And we decided that we wanted to meet our clients at their homes or meet them where we can. So we started modifying some of our testing services, and we came up with an at-home testing program through a situation with a client from Connecticut, kind of, on the border, but, just can't, be a Rhode Island resident kind of situation. So we pushed for this, program to come up because we saw the need. And through that push, we found a positive where we were able to connect them to services in the middle of a pandemic. And I thought that was like really, really helpful in understanding the reasons why we have these services in place, just so that we can meet our clients.
And Ray, just so I don't forget with you too, like how often are you open currently for in-person testing?
For in-person testing, we are open Monday through Friday from 10 a.m. to 4 p.m. Appointments are recommended, but if they come with no appointment, nobody's being turned away. And we operate in outside in a tent, so clients can come to a tent. We sit on the inside of the building. The tent is on the outside, and with a partition in between, so that way we remain safe.
Cool. I wanted to make sure everyone that might be watching knew that there are all these available to them. And that kind of brings me to another question. What I know just anecdotally I've had from clients that I've interacted with in my day job is that there's been some conversation about antiviral medication, like especially like PrEP, or people who are HIV positive and on their meds, that might be helping protect them against COVID. And Michaela, I'm wondering if you know any more about, I know this is really early in the game to be talking about this, but I assume it's something that a lot of providers are kind of chattering about right now. What do you say about it?
Yeah, providers and patients. I get a lot of questions about this among my PrEP patients specifically. I think the honest answer right now is that we still really don't know. We don't have enough data, enough research to really figure out if these medications are going to be effective at both treating or preventing COVID. I think the one major study that a lot of folks are referring to is it came out of Spain, and it was a study that described incidence of COVID among HIV positive patients. And in particular, those that were receiving antiretroviral therapy. And basically, it looked at both the incidence, so the number of cases of COVID, and then also hospitalization data. And if you look at the report, it was published on Annals of Internal Medicine, and it showed that in a 3-month period, there were 236 patients with HIV who were diagnosed with COVID, and that 151 of those patients were hospitalized. And basically what it showed was that among the patients who were taking NRTI therapy, which is one of the classes of HIV medications, that they had a lower, there was a lower risk among patients specifically taking emtricitabine tenofovir, otherwise known as Truvada, which is one of the main medications that we use for PrEP, but it's also one of the major medications that we use among patients who are HIV positive. We usually use a combination of meds. And so this has sort of spurred this discussion about whether or not medications that we use for HIV and PrEP may be potentially used in treatment for COVID or in prevention for COVID. And I think that they're interesting. It's interesting to talk about, and the results from the study were certainly interesting, but they're not enough. There were a lot of sort of other confounding factors that may have influenced the data. And, we've seen in just many other studies that there are medications like NRTIs that have or demonstrate in vitro antiviral activity to SARS-CoV-2, but in vitro doesn't actually mean in human beings. So we're not quite there yet. I think the important thing to remember about all this, though, is that number one, the research from that study is prompting a new clinical trial among healthcare workers in Spain, where they're actually assessing the effectiveness of emtricitabine tenofovir or Truvada and hydroxychloroquine. So I think that's really interesting, and to see if that might be a form of prevention for COVID. And I think the greater or more important thing that we have to remember as providers and patients is that these results and the results that we're seeing, it's still too early for us to make decisions about changing or putting people on medications. So we shouldn't be all of a sudden changing antiretroviral therapy regimens or putting people on PrEP just to protect them against COVID. We're not there yet, so don't jump to those conclusions yet. But it's certainly interesting, and I think if we can find a medication to help us with COVID that already exists, certainly that would be really helpful. So I have my fingers crossed. I'm really excited. I think this is some really interesting data, but don't go doing anything crazy yet, because we're not there yet.
I was just going to say, so just because you happen to be on PrEP or you're taking HIV meds, that doesn't mean that you're not going to get COVID, right?
No, it doesn't. It doesn't. And we want people to take their HIV meds, and we want people to be on PrEP who need to be on PrEP, but we shouldn't do it for reasons related to COVID at this point.
And Matt, that kind of brings me back to you a little bit, where it's like, I mean, we know that HIV transmission, a lot of times it happens when people don't know their status. And I mean, do you think with like some of the interruption that's been going on with testing and outreach efforts that, I mean, do you think it's possible we're going to see an uptick in HIV cases down the line? Or are you feeling more optimistic because like maybe COVID's kind of made a lot of people less sexually active?
I think it's hard. I do think it's hard to predict. I don't foresee COVID impacting the rapid increase in bacterial STIs. I think syphilis, gonorrhea, and chlamydia, the trends that we were seeing of just the increase of bacterial STIs, I don't think that we will. I don't personally, this is just my opinion, so I don't have any secret knowledge that, to confirm this. My sense is that the trends for bacterial STIs, gonorrhea, chlamydia, syphilis, will likely continue to increase. And there may be it would be interesting to see what, if any, the impact of COVID had on those rates during this time. I do think it is more difficult to predict HIV in many ways. And I think, to go back to what Rich was saying, I think one of the major concerns that I have is just the real difficulty in accessing substance use treatment during this time. And so there has been a lot of concern and some initial data that there's been an increase in overdose deaths during these past few months. And I think that I am concerned about the implications for folks with substance use disorders and co-occurring conditions. There was recently a bulletin from the Boston area around an outbreak of HIV amongst injection drug users. I think this is for folks who work in the substance use space, this is a real concern. Just because it's been really tough to get folks who use injection drugs on PrEP and just in general connected to care. So that is something I really worry about, that we may be late in detecting outbreaks particularly amongst folks who might be injecting drugs or have serious substance use disorders, just because their overall connection to care has been really impacted during this time. I will also say too that in addition to my role at Open Door Health, I do work in the Department of Corrections as a staff physician, and I'm helping to oversee their PrEP implementation. And I am really concerned it's really difficult to link folks, more so than normal, to link folks to care, particularly for PrEP, STI care, upon release, community reentry and release from the correctional system. So I just really think, I really do worry about folks who are marginalized and vulnerable, just in general, being even more marginalized and vulnerable during this time. And I think the risk for HIV is one of those. And I do worry about, and it seems like, at least for overdose deaths and the impact of substance use, I do worry that we are seeing that there is evidence of that during this time. So I say that's what keeps me up at night a little bit, is particularly the folks who are really struggling with severe substance use disorders.
Actually, that brings up this is just kind of an ad lib off the top of my head, but Rich, I know you and I have been in a variety of meetings over, several years now where we talked about crystal meth. Opioids get a lot of press, and rightfully so, but I know for a lot of men who have sex with men, that crystal meth is also a big issue. I'm assuming you're still seeing a lot of that.
Absolutely. Absolutely. Yeah, I think as important as like the opioid epidemic is to talk about, and it does seem to be on the front page of everything right now, and a lot of other really important topics have taken a back seat, or you don't hear much about anymore in the media. But I see it out on the streets and with my clients every day. Crystal meth use. The Megaplex in Providence is still open. There's plenty of activity on those back streets. A lot of our sex worker clients have left the streets and now they're on Grindr. Now they're on Scruff. They're selling sex on the apps. Party and play, crystal meth use in the time of COVID. It's definitely still here. It's still going on. And we don't hear about it a lot. And I think, in my opinion, crystal meth use is sort of it's a slow death. It's a death over a period of time, where the opioid epidemic, it's more of an immediate thing that sort of, you use heroin, you can die from a heroin fentanyl overdose right away. So but crystal meth use, it pains me all the time. I have a handful of clients who are struggling with meth addiction, and every day you see them, life is just slowly being drained away from them. They're losing their teeth. Some of them are HIV positive, and they're still injecting methamphetamines on a daily basis, and they're not on medication. So like I said before, the obstacles and challenges of sort of getting these people to sort of go to their doctor to address their HIV when they're in the grips of their meth addiction. It's very challenging and painful to watch, really. But yeah, I just wanted to confirm it's still very much alive out there.
Yeah, I appreciate that. I appreciate you saying that, because I know it's something that comes up a lot, and it kind of gets lost sometimes in some of the other discussions we have. So just to kind of, we've had a couple of comments and questions come in while we've been talking, and Doreen, Michaela, Matt, these might be a little more geared toward you, and feel free to jump in, whoever wants. But one question was, is coming to a health center or a clinic to get tested safe right now? I'm not sure who wants to make a deal.
I would love to address that, because we address it every day. Thundermist is now, again, fully open, whether it's indoor for people with no COVID symptoms, or respiratory tents that are for all health conditions, but people with COVID-like symptoms. We have convenient care. We have 3 convenient cares. We're open 365 days a year from 8 to 8 right now, and we're open from 9 to 5 on the weekends. We do full STI testing. And also, I just want to promote, Thundermist also has a pretty invested trans health program, where we provide medical care, we provide behavioral, we provide social services, we do social events, and even kind of day to day, when you walk through the halls of Thundermist Health Centers. And I noticed when I came here that none of our bathrooms have male, female on it. There's lots of signage. You're safe here, you're welcome here. And it's an excellent, excellent healthcare system. I've been a nurse practitioner for over 25 years, and I have to really, really rave about the health centers at Thundermist.
I want to say, one of the major concerns as a healthcare provider during the height of the pandemic for me was that I was always so fearful that people were not going to get the care they received because they were afraid of getting COVID or being at risk for COVID. We saw that there were so many instances where people weren't going to the emergency department or seeking primary care services or urgent care services for things that really needed those services. And so I think we need to reassure our patients that we've been dealing with COVID now for over 6 months. We have a pretty good grasp, I think, as a state, and certainly in these different healthcare communities about how to handle either possible cases of COVID, symptoms of COVID. And I think each medical practice and each community health organization are doing specific things to help keep both their providers, their employer, their employees, and their patients and clients safe. And quite frankly, I think being in a medical office is probably way safer than being at a restaurant or at a bar or at a supermarket even. And so I think we want patients to be able to seek those services if they feel like they need them. I think making sure to remember to wear your mask, to socially distance. I know at our clinic, we're screening patients daily when they come in for their appointments. We're making sure that everyone working in the clinic, whether you be a provider, a secretary, a medical assistant, that you're also checking yourself daily for symptoms. There are reminders about standing 6 feet apart when you're checking in. And so I think all of these precautions are in place to make this a really safe environment for you. And so we definitely think it's safe to come to a health center and get tested. And I highly recommend folks, if you feel like you need to get tested or you're due, if it's that time of the year for you to come in and get your routine test, please, please, please do that.
Matt, did you want to?
Yeah, and I'll just add, I think, totally echo what Doreen and Michaela mentioned. I think that we're also trying to meet folks where they're at. And, one of the things I really enjoy about being a primary care provider is trying to negotiate safely access to the health system, particularly with patients who we know and have developed a relationship with. So I think for folks who are concerned about their risk of, exposure to COVID or being in certain social situations, and I think it can be really helpful to have a primary care provider and try and talk through those issues as much as possible, and try and come up with a contingency planning that's right for you. I do think that it is helpful that right now we're able to offer telemedicine, particularly for folks who are nervous or concerned about leaving their house and what exposing themselves or their family might do. I am thankful that that is an option. And I think that using that wisely and trying to figure out what you can do virtually and what you can do in person is something that I know a lot of other providers are willing to work with folks on to figure out what makes the most sense for them, just so that folks are having access to care. But I do agree, Rhode Island has been really great about the public health measures to mitigate the spread of the disease. And we do really have a better understanding of ways to reduce the spread and make folks safe when they do seek out medical care. So I think it certainly is important to do that.
I think it's, just to interject for just a second, because I get the pleasure of kind of working with all of you in different capacities. It's always really nice to remember too that there is, at least in my experience, there's been a really nice relationship between like a clinical practice and then these, our community-based organizations that really, when people come to us, for example, and need services, that we can go to you and get the handoff, and it's not, people don't get lost in the system. And when we try really hard to make sure that people have this continuity of care. So, I mean, my next question out of all of this is really kind of a free for all, whoever feels like they want to answer it. But it's like, I think we're all a little nervous about fall and winter right now. And there's no vaccine for COVID. People are kind of like, are we in a pod? Are we socially monogamous? Like, what are we doing? Like, what's some of the advice? What do you think people should be doing this fall and winter?
Safely voting.
I think that's the $1 million question, though, is what are we going to do? And I don't think we know. I mean, I think we need to be sensible. We need to continue to wear our masks and be outside as much as we can. And, Doreen gave a really wonderful long list of things in terms of our sexual health. And some of those ideas were quite great. I think we need to get creative. And I think that's the beauty of what COVID has done. If there's one sort of positive, half glass full thing that I can say about COVID is I think it's allowed everyone to get creative about the way that we interact with patients and our friends and family members, and get creative about the way that we provide care. And so I think we have to continue to do that. And I'm really interested to kind of see what happens, because I think that hopefully some of the things that we're learning and the ways that we're doing things, hopefully we'll continue to do this stuff even after COVID.
I agree wholeheartedly.
Yes, I agree too.
Yeah, I think it's a perfect time to start.
Oh no, go ahead. I'm sorry.
Perfect time for us to be creative so that we can start normalizing talking about our health goals and some of these like stigmatizing or touchy subjects. So yeah, I also feel the same way about COVID. I think it's a great time for everyone to just be like, did you wash your hands today? Just a good way to start breaking those ices.
And something that we've been more diligent about is not depending necessarily on our cleaning crew, but putting it on the onus of our staff as well to make sure that they sanitize, wipe down all areas that are being touched, not only by clients but by themselves. Making sure that those policies stay in place post COVID too, definitely a key.
Yeah, I'll piggyback off what Ray said. We're pretty diligent at the office of, everybody doing their part to sort of, clean the surrounding areas, clean the outreach van, after it's used. We're all on top of that stuff. So.
And to piggyback off the voting, which was in jest. I do think that we are seeing right now the importance of institutional knowledge and the need to take evidence-based decisions. I think one of the big decisions that we're likely going to have to take as individuals and also as organizations over the next few months is going to be the decision of whether or not we take the COVID vaccine. It does seem like we're progressing to that place where it might be available over the coming months. And I think that we really should, while we make decisions beyond just the COVID vaccine, but the decisions that we make in our own personal lives to keep ourselves and those that we care about safe, which hopefully in the near-term future will include a vaccine, is just to make sure that we're seeking out sources of information that are level-headed, that are evidence-based. And I do think, this again is one of those moments where I really am happy that I'm a primary care provider and I can help folks navigate those decisions with them from a place of, they're looking out for their individual or their family health. And I think if you can trying to seek out those resources, both people and then information sources, I think is going to be really important over the coming months. So encouraging people to do that.
And to get your flu shots. Don't forget about your flu shots. We know that those are safe and effective. And so, that's one thing that we can certainly do as we enter into the fall and winter months.
I want to add that Thundermist has changed all of our respiratory tents to trailers now. So we have trailers in all of our parking lots. We're seeing people consistently in our respiratory clinics, which used to be tents and are now trailers.
Oh, Rich, I thought you were going to say something because I saw you were unmuted, but I was like waiting.
I'm sorry, that's from before.
But I was going to say, oh, what was that?
No, that was from before. I had it unmuted from before. So.
Michaela kind of beat me to the punch when I was like, not that it's necessarily sexual, but flu shots, right? So I mean, I think, you know, one of the things that we always, at least in my day-to-day work with APRI, is that we look at people coming to us as a way to kind of get them engaged with talking about their healthcare and, you know, have a very conversational thing that doesn't feel like it's in a clinic per se. And I mean, Jean, Ray, Rich, whoever wants to answer this, like, have you been fielding questions from people asking about flu shots or COVID vaccines or anything else of, you know, like what they should or shouldn't be doing?
I mean, one thing that I certainly have heard from multiple people is people being terrified of this vaccine, of refusing to take it. I've heard countless people say, I ain't taking no vaccine when it comes out. No, no, no. Like, they're very diligent that they don't want to take it. So I am hearing that quite frequently from the people that we serve. They're very wary of the vaccine. So.
Yeah, I would also say that I'm getting mixed reviews where I hear people are saying they're jumping for a vaccine that is like they're waiting to meet anybody until a vaccine's out. And I'm also hearing people say, I'll be part of the second study of this vaccine, waiting for more data. So yeah, a lot of like questionable approaches towards the vaccination.
Yeah, I mean, I think we're, again, like I've said, we're at a very interesting moment. And we just had another question come in that just says, is Thundermist or any other primary care or community organization doing flu shot tents versus needing an appointment for a flu shot? And I know APRI is not, but does anyone else want to answer that?
Well, I am from Thundermist, so we're beginning to give flu shots Monday. Knowing Thundermist, we have in the past I don't believe we've had tents, but you know, the world has changed, and I think if people are in need of flu shots, that we'll be working hard to meet that need and to be providing them.
What's going on with either Lifespan or Open Door and flu shots?
We're still waiting for flu shots as well. It depends on the state to sort of get some of these vaccines in stock, but we will be offering them to patients and healthcare workers. I think as of right now, I think a lot of this is being done by appointment, but it's really easy to make an appointment. You don't have to have an appointment with a provider. You can call and request an appointment specifically for a flu shot. Remember, you can also get these flu shots even at some of your local pharmacies. I think there's a big push in the state for everyone to be vaccinated for the flu. And so I can't imagine that there aren't going to be opportunities for everyone to access flu shots. And so I anticipate that in the coming weeks, we're going to start to see more and more opportunities for folks all over the state to be able to access the flu shots. Remember that, you know, the time to get them is really sort of the mid-end of September and to the end of October is really what they're recommending. So we're going to need to kind of bump up our efforts in the next couple of months to make sure that everyone in the state gets vaccinated.
We just got our vaccines. So like and we are also very flexible. We have, right now we have our plan is to administer flu vaccines, kind of focusing on our primary care patient population. But, you know, give us a call. We are going to be low barrier to accessing vaccines and preventive care. I do think it is great for folks who are otherwise healthy, who might be required to get the vaccine for work, or maybe it's been a while since you've seen the doctor. It's a great reason to go check in with your primary care doc, do a little bit of fall check-in. Hey, flu vaccine, maybe get that at the STI checks you haven't gotten in a little while. So we're of course happy and willing to do that. And we're excited to be able to, you know, because we have also been eagerly anticipating the arrival of our flu shots. That's how nerdy we are, right? In the preventive care world, eagerly awaiting the flu vaccine to arrive. So glad that it's here.
And our clinics are always open door. Our convenient care clinics are only walk-in, and again, open long hours, 7 days a week, 365 days a year. So we do provide convenient care, does provide flu shots. So welcome.
Nice. I know we're about a minute before 7 o'clock, so I really just wanted to kind of open it up to if there was anyone. I mean, we don't have any other questions waiting in the wings per se, but if there's anything anyone else would like to say about the subject at hand this evening, feel free. I'd love to hear what you have to say. Or not.
If you guys get a chance, back in the early epidemic of HIV, Robert Berkowitz wrote a book on how to have sex during a pandemic. So if you're ever interested, and he have a follow-up book as well, if you ever want some sense of general knowledge to kind of guide yourself into how to build your own set of routines and gauging your own risks, it's always a good place to start.
As I've seen, there's a hashtag going around on a few things. It's for a lot of queer folks. It says, "Not our first virus." And, you know, I think for some of us at a certain age, like myself included, that kind of hit a mark. And, you know, hopefully we just, you know, keep each other safe and make sure we're doing what we can with the people that we're seeing to make sure that they stay healthy too. So I really appreciate everyone being here this evening and taking the time, and everyone that tuned in and sent in a question. And you are all awesome, and I'm proud to work with you. And you know, I know we got a long road ahead, so keep it up. And yeah, I think that's probably it for tonight, unless anyone has anything else they'd like to say. I don't want to cut anyone off. All right. Well, thank you all so much for being here. I really appreciate it. And thank you everyone else for tuning in, and have a good night and stay safe and healthy. Good night.
Good night.